If you're new to the channel, my name's Lee and this is Lee Runs Ultras. In this channel I cover everything running advice, running tips, race reviews, kit reviews, my training and also injury prevention. In today's episode I'm going to be talking about calf pain. Now before we start this video, I'm going to put a disclaimer out there. I am not a physiotherapist, I'm not a doctor, however I am a personal trainer and I have been a personal trainer for over 10 years and I have huge experience in running injuries and in specific calf pain. So before we look into calf pain then, we need to understand that there's different types of calf pain, and if you understand these different types of calf pain then you can treat your injury in the best possible way to give you the best chance of coming back and being a stronger, fitter, better runner. So the first type of calf injury is type 1. Now, if you've been out for a run and afterwards you have DOMS, delayed onset of muscle soreness. Basically, this is your body's built up too much lactic acid and it can't flush it out. So if you've been for a run, you've gone more hills than you usually would, sometimes you can get tight calves. When you get back, if you have tight calves, they could be a little bit painful, but they're going to be a little bit tight when you try to stretch them off. Now the second type I'm going to discuss is a calf tear. How can you tell if you have a calf tear over a calf strain? So if you have teared your muscle, you could possibly have pain when you touch the area in the center of the calf. Running is going to cause you pain. This could be a possible tear. Now, as I said, I'm not a physiotherapist or a doctor. If you do have pain when you're running or it's painful to touch, please do seek the advice of a qualified physiotherapist and get it sorted that way. The third type we're going to discuss is a rupture. Now, this can happen at any point. How do we tell if we've got a rupture? Usually you walk with a limp, it's that painful, it's painful to touch, it's painful to walk, and you've got no chance of running. This could indicate that you have a rupture in your calf muscle and you need to take the appropriate steps. Okay, now that we understand the 3 different types of calf pain you could experience, we need to understand how best we can treat these. So it goes without saying, the moment you receive any calf pain, we adopt the RICE method. So RICE: rest, ice, compression, elevation. By rest, it means what it says in the tin. If you're experiencing calf pain and it's anything over your usual DOMS, then we need to rest and then continue with what I'm going to speak about in the video with prevention and strengthening. After a period of time has elapsed whereby your calf is feeling a little bit better and not so tender to touch. Ice. Okay, the reason ice works is when you get injured, your body triggers an inflammatory response which essentially sends blood cells to that area. Now, our body overreacts and it sends too much blood cells. Therefore, the oxygen can't pass by. What icing an injury does is it contracts. Essentially, then the cold slows down the metabolism of the cells and that therefore reduces swelling and they utilize the oxygen they do have more significantly. A little bit scientific, but that is why we ice. Caveat to this, if you ice for too long, then it can be bad for your muscles. The recommended time to ice your injured calf is between 10 and 15 minutes. So why does compression work and why should you do it? Now, compression increases, so any compression on the body increases blood flow. Increasing the blood flow is obviously going to increase the oxygen that your muscles receive, therefore allowing your calf to repair a hell of a lot quicker. And then the last one, elevation. As long as the injured part is elevated over the heart level, it is going to reduce the swelling or reduce the amount of blood getting to that area, therefore bringing the swelling down. So that is the first treatment, rice. Another point to note is if you do have calf pain, don't overcompensate on the other leg. This is going to cause all sorts of other injuries that could lead to you being not able to run for a hell of a lot longer. This includes hip pain, back pain, so try and walk as normal as possible to stop that from happening. Depending on what type of calf pain you're experiencing will depend on your recovery time and the healing process. Again, I'm not a physio, so if you do have type 3, which is the rupture, definitely go and see someone. If you think it's just a little bit of DOMS, then do some glute bridges. Glute bridges are perfect because they don't really trigger the calf muscles and they keep your legs strong and mobile. Now, probably the reason you've clicked on this video. Why do you get calf pain when you're running? The first thing I'm going to discuss, somebody's grinding. As if like. The first thing I'm going to discuss today is, have you just started running? If you are new to running, chances are you guys have done too much too soon. Running is like anything. To be good at running, you can't expect to dive into the deep end, and it's a natural progression. If you start running and you go out and you do too much too soon, what I mean by that is you run too fast, too quickly, or you do too much mileage too quickly, or you do too much elevation too quickly. Chances are you're going to get some pain in your calves. The second reason you could have calf pain. Now, if you are a new runner, chances are you've watched some videos on how to run. If for this reason you have altered your running gait, you've gone from a heel striker and you've heard that heel striking is predominantly bad for the running, and you've tried to switch it up to a more forward foot, then your body's not going to be used to that running gait. You're going to be running too far forward on your toes, your heel's going to be too elevated, and you're going to experience pain in the soleus and gastrocnemius. The final reason you could be experiencing calf pain whilst running is because of the kinetic chain. Now imagine everything is connected, the kinetic chain. If you have tight hips, weak glutes, then this is going to cause malfunctions further down your kinetic chain. Therefore, you need to start doing some hip strengthening exercises, glute strengthening exercises, and some TheraBand work. Now, these are just a few exercises that I do that prevent me from getting any calf strains and also giving me strong hips, strong glutes, and being as flexible as possible. Other tools you can use to help assist in the treatment of calf pain and the strengthening, and why I pick strengthening over stretching is because if we're strengthening the calves, strengthening the glutes, strengthening the hips, chances are we're going to prevent the injury from happening again. The balance board is an absolute amazing bit of kit if you want to get some exercises and work on that single leg strength. Calf raises off the stairs or off a step, simply you can start both footed and then you can move on to single leg calf raises, flat on the floor, and then move on to the elevated. And then if the pain isn't that bad, you can start introducing a foam roller or a tennis ball. Guys, thanks for watching the video. If this has helped you out in any way, click the like button. Make sure you subscribe to the channel. And remember, I'm not a physio. The first port of call is to get your calf checked out by a professional. And as always, we'll see you now in a minute.
I ran up a check, I might do it again. Enemies close, had me thinking they're friends. 10 toes down, I'll be free until the end. Crib outside the city, I don't feel safe in my hands. Took so many years, I'm just waiting for the wins. I'm in debt to no one but the one who took my